Being a new or expecting parent is like being on a roller coaster. The ups and downs can be exhilarating, uncertain, and sometimes overwhelming. Often this is not the image of parenthood that is portrayed in media, books, or the internet. It can be a time of incredible isolation, and frequently it can feel like your world has become tough to manage. Most women suffer from some form of the baby blues following the birth of their baby. The baby blues, beginning a few days after birth and occurring in up to 80% of all new moms, can cause sadness, moodiness, and sleeplessness, but they are typically mixed with periods of happiness. The baby blues usually end 1 to 3 weeks after delivery. Postpartum depression, by contrast, is more persistent and severe and occurs in up to 20% of all new mothers. Symptoms of postpartum depression can include anxiety, restlessness and irritability, feelings of extreme sadness, hopelessness, or worthlessness, difficulty caring for the baby, obsessions and compulsions about the baby's health and well-being, often referred to as scary thoughts, loss of interest in one's pleasurable activities, and sometimes persistent thoughts of death or suicide. It is important to remember that this is not your fault. Postpartum depression can be caused by physiological, emotional, or social changes occurring in a mother's life. With the birth of a baby, a woman experiences significant shifts in her hormones and important neurotransmitters. She might have her historical trauma or relationships stir up a sense of distress. She is likely keenly aware of her changes in social environment, which might include a disruption to her own role in society. A complicating piece is that some of these symptoms are similar to things that one might experience secondary to just having a baby. All new parents experience a sense of fatigue and often a sense of overwhelm. In my practice, I find that people reach out for help roughly 4 to 5 months postpartum. Anecdotally, my theory is that by this point, they just can't take it anymore. They've tried to manage it and on their own, tried to be strong. Postpartum depression, or any form of mood disorder during or after the pregnancy, can be treated, and the mother can feel better. Please remember, this is not your fault, and you are not alone. Reach out, there is help. If you think you would benefit from speaking to a licensed therapist, please visit www.counselingcalifornia.com for helpful resources, information, and articles. Counseling California is an extensive online directory of over 8,000 therapists throughout California and is searchable by a variety of means, including city, zip, and area of emphasis. There is no cost to use the website.